Hello, everyone. My name is Elizabeth Castro, and today we are going to talk about radiation therapy. I believe that radiation therapy is extremely important and essential and even fascinating because of how it actively treats cancer patients. And yeah, so today we're going to talk about the role of radiation therapists, what they do each day, where they work, and how they make a difference in the lives of patients needing radiation care. Okay, so description of health provider slash field. So, what exactly do radiation therapists do? A radiation therapist is a specialized healthcare provider that delivers targeted radiation treatments, usually to cancer patients, and they work closely with radiation oncologists, which they typically prescribe the actual treatments, and they also work with medical physicists who plan their treatments. These professionals use advanced technology and machines like linear accelerators. And these machines are meant to aim powerful beams of radiation directly on cancerous tumors, and but also in order to protect um, healthier tissue on the body. So where do they work? Radiation therapists typically work in hospitals, outpatient cancer centers, specialized medical clinics. Um, Cancer treatments don't, or they do, they follow a daily schedule over several weeks at a time. And so therapists usually work during regular business hours, but depending on the facility, they might have to be available for extended or on-call shifts. So for a typical day for radiation therapists involves more than just operating the actual cancer, um, the radiation machines. They usually review patient's treatment plan. They help position the patient in the machines, and which sometimes they actually use markers or molds in order for them to be positioned correctly, and that the radiation hits the correct spot. Um, they explain the procedure to the patient, deliver the radiation treatment, and observe the patient for emotional or physical reactions during treatment and afterwards. It's important that their safety is the number one priority and that precision is ensured while they're receiving treatment, because the right amount of radiation has to be received and the correct location. And after treatment, therapists keep detailed records and monitor for any side effects. Okay, role in patient care. Um, Radiation therapists are commonly misunderstood for just not more than just pushing a button on the machine to deliver treatment, but they actually play a major role in patient comfort and care. Cancer treatment can be extremely scary, emotional, and draining for patients. And it's the radiation therapist's job to see the patient every day for the weeks at a time, which means it's important that they build trust, provide emotional support, and become a consistent, calming individual for many of their patients. Um, it takes a lot of, it's important that radiation therapists have technical skill in order to do their job correctly, but it's important that they also have empathy, um, for coworkers, patients, and yeah. So career outlook. Um, According to the U.S. Bureau of Labor Statistics, um, radiation therapists receive a median pay of around $89,530 annually. And the demand for this profession is remaining steady, so it's not declining, but it's also not increasing, mainly because the population is aging and advances in like cancer to detect detection and treatment is advancing. But it is a career that offers financial stability and a sense of purpose and yeah. So emotional background needed. So they have a few basic requirements like earning an associate's or bachelor's degree in radiation therapy or a related field in order to then complete an accredited educational program through a college or a hospital-based program. They also have a couple certifications like passing the ARRT, which is the American Registry of Radiologic Technologists. And that is actually a certification exam that they must pass. And certification requires meeting education, ethics, and examination requirements, which follows into them needing continuous education even after they start their profession because they need to be kept up to date with ethical standards and maintain their certifications like the ART and some personal skills, abilities, and traits that is important for radiation therapists are technical skills like being able to operate complex machinery and follow detailed radiation protocols. It's also important that they have interpersonal skills like compassion, patience, and the capability of comforting patients who are in pain or might be anxious. It's also important that they pay attention to detail because precision is extremely critical for radiation to be delivered safely and effectively. And finally, physical stamina is important because therapists often stand for a long period of time and assist in positioning patients to have the laser correctly on the tumor. Um, ethical and professional conduct. If it's, radiation therapists follow strict professional and ethical guidelines like patient safety and confidentiality to ensure that they have the best care that they could get and that their their information isn't shared with other sources.
Hi, my name is Adela Yonan, and I'm the second presenter with this project in Elizabeth Castro. I will be talking about the last two things with this employment opportunities, regulatory body, and the reasons why somebody would like to go into radiational therapy. There are different types of locations that somebody might want to go into with radiational therapy degree. They can go into hospitals, doctor's office, outpatient centers. They most typically find these three places the most like drawn to, but they also can find opportunities in research positions at universities or in data analysis. There's also different types of employment in radiational therapy that they might like, and there's like a deep range. So some examples include radiational oncologists, radiation therapy, radiological technologists. These are all types of different places that they can work and be. And it is also expected to grow for radiational therapists specifically an 3% from 2023 to 2033 from the US Bureau of Labor Statistics. And there's also about 800 openings for radiational therapists that are projected to grow each year on average over the next decade, which is all interesting. With that being said, these radiational therapists and radiational therapy degree have a regulatory body and a code of ethics. Their regulatory body is the American Registration of Radiological Technologists, which is the ARRT for short. This is a certification and registration that is showed to individuals that are able to perform their certain role. It is a process of medical imaging and disciplines. And having this certification shows that they are being their best care to the patients, that it shows ethically that the professionals are performing the highest of care to their patients. And the code of ethics is to show a guidance to those and know the qualifications that are needed for their patients and to protect the patients. And there's a code of ethics and a rule of ethics. So the code of ethics is a guide, like I said, and then the rule of ethics is the rules that are mandatory for them to follow. Holding a RRT certification it is not and is a job prerequisite depending on which type of place you go into, but having this credential shows that your employers that you are determined to provide that highest level care for your patients. And that is really important because that is easier for you to show your employers you want to do this and you want to help those in need. And going into this, there are many reasons a person may choose to do this career. And the first question or the first part is to play an important role in their patient care, meaning that in radiation therapy, a radiation therapist plays a crucial role in a patient's care, especially with patients with cancer that are having in-depth treatments and that have to do with radiation therapy, meaning that through the work that they are providing, they are able to provide an improvement on the well-being of those that are being injured. So that might be a reason why somebody might choose this career. Another reason may be because they have a working schedule that is flexible, and those meaning that the therapists work regular hours and they typically are able to like either stay for the weekends and enjoy like certain times and they know their predicted schedule so it doesn't change that much, which a lot of other medical people have like a different type of schedule. Some of the like job opportunities are why some people might choose this career because it's such a wide range. And when looking at a job opportunity, their options are less limited because of the different types of levels a radiational degree can get you. It's the fact that you don't even need to stop at like a radiational therapist. You can go deeper into it. And having open opportunity and open door policy kind of is really good for people who want to continue their job and maybe move or anything like that. Plus, another reason is that the career is high in demand overall in the United States, and having a high demand degree is important because it's easier to find employment once you have your certification. The Bureau of Labor Statistics also showed a 3% growth in radiation therapists from like I said from 2023 to 2033. But it also shows a 9% growth in radiation therapy in general employment by 2028. And lastly, a person may indulge into a career in radiation therapy because they are being able to work in different job locations. Depending on your interest, you can work in whatever type of area you'd like. And you can work in like medical clinics, hospitals, pediatrics, or outpatient centers, whatever you want and feel comfortable in. That might be another reason somebody might prefer to have that as a career choice instead of other medical places or just other careers in general. So this is a really good career to choose if you like helping and if you like the wide opportunity. It's really high in demand. I would overall say it's a pretty good choice. So these are some of our references. And then thank you so much for listening to this presentation. It was a pleasure, and any questions can be asked. That's the end. Thank you.